Hi, my name's Ida Karan. I'm doing an MSc in clinical nutrition. I'm an osteopath and I'm really interested in the link between nutrition and disease. There's an epidemic of non-contagious diseases taking over the developing world. Metabolic disease directly linked to obesity and overweight. Losing weight is far from easy. Preventing obesity and overweight is the way forward. According to the World Health Organization, 60% of obese adolescents have obesity problems throughout their life. So the best way to prevent obesity and overweight is to get them while they're young. Which brings me to my area of health evaluation, which is childhood obesity. Specifically, the French approach to childhood obesity and the policies that have been involved. France's childhood obesity figures are amongst the lowest in Europe. The question arises, why is this so? Which specific policies have resulted in these figures? And are other factors playing a part? These graphs taken from Economic Cooperation and Development show that France has one of the lowest obesity rates in Europe, with 1 in 10 people obese and almost 40% overweight, with projections increasing by 10% over the next 10 years. Obesity rates are low amongst children too, and have not grown over the past 20 years. By comparison, the obesity rates in Britain are the highest in Europe, with 1 in 4 people obese, with overweight people projected to raise a further 10% over the next 10 years. 1 in 3 children are overweight in both Britain and Scotland. EPODE, Together Let's Prevent Childhood Obesity, is believed to have had a considerable impact on the French figures for childhood obesity. EPODE is a large-scale, coordinated capacity-building approach for local communities to put sustainable strategies in place to address this challenge. Pilot studies were effective in 2 small towns in France in 1992 and spread to more than 500 communities worldwide. EPODE has 4 critical components. 1, the political component. 2, public and private partnerships. 3, community-based actions. And 4, evaluation. EPODE stakeholders and evaluation framework. Firstly, there have to be political representatives, i.e. the mayor, who needs to endorse the programme. The mayor has control over urban development, schools, catering standards, and is able to define priorities in the local economic centre. So that's the local mayor. They also introduced a mayor's club at EPODE, where the mayors would all get together to make obesity possibly preventable on a global priority, to engage on a national level, thereby engaging more stakeholders, more PPPs. That was that. The important other factor was the Central Coordination Team, the CCT, which implements the programme by training local project managers who mobilise local stakeholders like teachers, local companies, catering services, etc., and employ a social marketing team too to develop the message, actions and tools to influence the social and physical environment this all plays. The CCT designs the evaluation programme, which is a key driver for mobilising the politicians and stakeholders, and allows media coverage, which in turn motivates the target audience. Clever stuff. The French government brought out a national nutritional and health programme in 2011 to 2015, focusing on social nutritional inequalities, increased physical activities and limiting sedentary behaviour, detection and management of nutrition-related health conditions, and the prevention of nutritional disorders for the disabled. So far, I've not found much emphasis on children. Could it be that EPODE dovetailed their interests with the government? I've yet to find out. Context, contributing factors, money, regulation, other. There's a socio-economic divide with obesity and overweight growing fast in lower middle-income countries and poorer portions of society being affected in higher income countries. Obesity and overweight equals an increase in ill health in the form of metabolic syndrome and related non-communicative diseases, i.e. diabetes, cardiovascular disease causing heart attacks and strokes, and some cancers too, plus an increase in musculoskeletal disorders such as osteoarthritis. Thirdly, putting more pressure on the cost of health services, causing depression, disability, and increasing mortality rates generally. The good news is that obesity and overweight is largely preventable. By choosing healthy foods, decreasing fats and sugars, increasing the consumption of fruit, veg, legumes, whole grains, and nuts, and engaging in regular physical activity, 60 minutes a day for children, 150 minutes a week of cardiovascular exercise spread over the week for adults, particularly with the right health-related policy. This multi-stakeholder approach was adopted by the UK government in 2016's Childhood Obesity: A Plan for Action. The idea behind this policy was also to involve schools, parents and children themselves in targeting healthy eating and exercise, both at preschool and school levels. However, in this case, as we've seen from the previous data, the results don't seem to have been quite as successful. The aims of this evaluation are to assess the impact of local childhood obesity programme incentive EPODE in conjunction with the French government policy on childhood obesity to gain insight into how well the goals were achieved, what resources were used, how well the policies worked, comparing the relative impacts of policies within different components, discovering whether key indicators occurred since the implementation of the policy. So how to start it off? Well, I plan to first develop a theory of change model to assess the core questions. What action is required to reduce childhood obesity? To describe the content and evaluate EPODE and the French government policies as background in order to find the reasons the policies appeared to have the impact they did, paying particular attention to EPODE and seeing if there's a link between the two. EPODE is ongoing. How was it implemented? Seeing if anything was missed out. I'm interested in seeing how the data was collected, if it's possible, and seeing what other resources are available. Seeing if there was a national campaign that ran alongside dovetailing it. Could the policies be improved? Were there pitfalls? With the main aim of the evaluation being the impact of EPODE, who appear to have a winning formula. The weight of evidence suggests that choosing healthy food and exercise needs to be an easy option for it to work. It needs to be accessible, available, affordable, with local environments and communities supporting the incentive, along with national and local government involvement, healthy food available, multimedia involvement too, education and support very much in place. EPODE in particular, probably with the French government, made a difference to childhood obesity. I'm looking forward to understanding and evaluating the policies to see how they made that happen. Bye. Thanks for listening.